You have been asked to give a teaching session to a group of final year medical students. The topic is Management of Bradyarrhythmias in the ED. Which of the following is recognized as increasing the risk of progression to systole? Options are A. First degree AV block with broad QRS. B. Second degree AV block, type I. C. No AV block with a QRS more than 0.15 seconds. D. Ventricular rate more than 25 beats per minute. E. Third degree AV block with broad QRS. Answer is E. Third degree AV block with broad QRS. Increased risk of systole. Recent systole. Mobitz type 2 AV block. Complete heart block with broad QRS. Ventricular pause more than 3 seconds. You are giving some bedside teaching to a medical student working in the emergency department. She has reviewed a patient who presented following a syncopal episode. She has performed an ECG and thinks the patient may have a prolonged QT interval. What is the typical cutoff for diagnosis of prolonged QT interval? Options are A. 350 milliseconds. B. 400 milliseconds. C. 450 milliseconds. D. 500 milliseconds. E. 550 milliseconds. Answer is C. 450 milliseconds. The QT interval, measured from the onset of the initial wave of the QRS complex to where the T wave returns to the isoelectric baseline, is the ECG representation of ventricular depolarization and subsequent repolarization and may be measured in any lead in which it looks prolonged. The most commonly used formula to calculate the QTC is Buzet's formula, QT divided by the square root of the RR interval, where all intervals must be in seconds. The RR interval is the interval between each QRS complex and should ideally be that immediately preceding the QT interval and averaged for 3 to 5 complexes. QTC is prolonged if greater than 440 milliseconds in men or greater than 460 milliseconds in women. QTC more than 500 is associated with increased risk of torsades des points. A 30-year-old man presents to the emergency department with a 1-hour history of chest pain radiating to the back. He describes a tearing pain that was maximal at onset. You note the patient is very tall with unusually long arms compared to his trunk and has long, spidery fingers. What condition may this patient have which predisposes to developing the suspected diagnosis? Options are A. Ehlers-Danlos syndrome. B. Marfan syndrome. C. Acromegaly. D. Fragile X syndrome. E. Brugada syndrome. Answer is B. Marfan syndrome. The presentation is suspicious for aortic dissection. Inherited risks include Marfan syndrome, Ehlers-Danlos syndrome and familial thoracic aortic aneurysm type 1 and type 2. Congenital bicuspid aortic valve is also a risk. Marfan syndrome is a disorder of the body's connective tissues, a group of tissues that maintain the structure of the body and support internal organs and other tissues. Typical characteristics of Marfan syndrome include being tall, abnormally long and slender limbs, fingers and toes, arachnodactyly, heart defects, lens dislocation or where the lens of the eye falls into an abnormal position.